The ethmoid bone is a small but very important bone located between the nasal cavity and the anterior cranial fossa. Even though it's light and delicate, it plays a major role in olfaction, respiration, and the structure of the orbit. Let's start at the top with the cribriform plates. The word cribriform comes from Latin, meaning perforated, and that's exactly what it looks like, a sieve-like plate with many small holes. These perforations allow olfactory nerve fibers to pass from the nasal cavity up into the anterior cranial fossa, where they connect to the brain. This is how smell information reaches the brain. Rising up from the cribriform plate is the crista galli. Crista galli means crest of the rooster, which is also a Latin word, and it's a vertical bony projection. This structure serves as an attachment point for the falx cerebri, which helps anchor the brain to the skull and limits side-to-side movement. Dropping down from the cribriform plate is the perpendicular plate. This is a thin, flat plate of bone that contributes to the nasal septum, dividing the nasal cavity into left and right sides. On the lateral side of the ethmoid bone, you'll find the superior and middle nasal concha. These are scroll-like bony projections that increase the surface area inside the nasal cavity. Their job is to help warm, humidify, and filter air as it passes toward the lungs. Finally, we have the orbital plates of the ethmoid bone. These are thin, paper-like bone plates that form the medial wall of the orbit, or eye socket. Even though they are very delicate, they play a critical role in separating the eye from nasal cavity. So overall, the ethmoid bone acts as a bridge between the brain, the nasal cavity, and the orbit, supporting smell, respiration, and eye structure, all with one lightweight but complex bone.